I'm Times Union editor Casey Seiler, and welcome to the 2021 Salute to Nurses. Perhaps more than any other year in a century, the experiences of the past 14 months has brought home to us the importance of New York's 273,000 strong core of nursing professionals. Whether they're clad in PPE and braving winter cold in tented testing sites, or working to keep patients on the road to recovery in hospital wards, nurses have been on the front lines battling the coronavirus pandemic. Though speaking personally, I'll be happy if my second vaccine jab is my last interaction with a medical professional until my next annual checkup rolls around. It's an honor for the Times Union staff to host this event every year, and we hope this program stands as a fitting tribute. With that, I'll hand things off to our host for the evening, someone who has brought the story of the pandemic to our readers with unflagging energy and craft, the Times Union's health reporter, Bethany Bump.
Hello and welcome to this year's Salute to Nurses celebration. As many of you know, this is the time of year we like to set aside time to celebrate and honor the outstanding and memorable nurses who care for our loved ones throughout the Capital Region. Somehow we are on year 2 of a global pandemic. I can't explain it, but that is why you are once again seeing us host this event in a virtual fashion. So welcome and thank you for being here, and thank you to our sponsors who made this event possible. Many of us, myself included, have had the privilege of working from home and behind screens for the past year. And I know that while many of us are exhausted by the trauma and the crises of this past year, I think it can be easy to forget that not everyone has been able to sequester themselves away in their homes, away from the risk and danger of this virus. Essential workers like the nurses we are celebrating today have continued to show up despite the exhaustion and weight of the last year. I've interviewed some of them, and the stories that they have told me about their experiences during the pandemic have frankly brought me to tears. I'd like to share with you the words of one such nurse because I believe that they embody the compassion that brings so many to this field, and also the grit, resiliency, and fortitude that allows so many to stick around. The nurse's name is Crystal Perry, and the nursing home where she worked was understaffed when I interviewed her at the end of last year. Here's what she told me when I asked her about burnout. She said, "I'm exhausted physically and emotionally and mentally. Emotionally, it's like I can't take another day. And it's just amazing how we feel like that, and yet we still go back the next day. We still go back the next day, and I want people to know that healthcare workers, it's not about that check. It's not about that money, because we can go anywhere and get a job and a paycheck. But the ones that stick around when a pandemic like this hits, and when that physical and emotional and mental exhaustion sits in, and you still come in every single day, that's what it's about. That's that humanity, that's that compassion, that's that empathy for human life, for the care of others, putting yourself in harm's way for the sake of someone else. That's what it boils down to. I don't do this for a paycheck because I can get a paycheck from anywhere. I do it because I have a genuine love and concern and compassion and empathy for human life. And so I go back every single day, whether I have a rough night and I feel like I can't take it anymore and I tell myself I'm not going back. I wake up the next day and I do it all over again. I take a deep breath and I say, this isn't about me, because if it was my loved one in there, or if it was me, I'd want that person to care. I'd want them to come back and help. That's what it boils down to. These words hit me really hard because I think about all the other nurses and essential workers who are likely feeling the exact same way these days. Nurses deserve our respect and our thanks, not just for the many ways that they keep us physically healthy, but for the humanity that they draw on to make us feel emotionally seen and safe during the most vulnerable times of our lives. So I hope you'll stick around as we take this time to celebrate and say thanks to just some of the many exceptional nurses in the Capital Region who show up every day, no matter how tired, no matter what. Before we announce the winners of this year's Salute to Nurses event, I'm going to introduce you to our keynote speaker, Chris Jordan, the Chief Nursing Officer at St. Peter's Health Partners, one of our sponsors.
Hello, I'm Chris Jordan, and I have the privilege to serve as the Chief Nursing Officer for St. Peter's Health Partners Acute Division. In this role, I have had the opportunity to witness the best of nursing firsthand many times over, to witness both the incredible care that the nurses of St. Peter's Health Partners in the Capital Region provide, but more importantly, the incredible caring for the patients and the community, Like all of you, this year has been the most difficult of my career. And while incredibly difficult, it has provided our nursing and healthcare community the opportunity to come together like never before in support of one another and in the absolutely incredible care provided to our community. COVID has challenged what it means to be a nurse. The ability to hold the hands of the dying patient or to comfort the frightened with a simple smile was replaced by masking, social distancing, and a fear of the unknown. Throughout it all, it has been the nurses within our communities who have been there to continue to comfort those who are at their most vulnerable, to protect our patients and our communities with caring and compassion. It is for this reason that we celebrate nursing during today's Salute to Nurses. I want to welcome each of you to this incredible event where we, once a year, recognize the accomplishments of our nursing colleagues across the Capital Region. Over the past year, we have heard countless stories highlighting the incredible work of nurses working at the front lines. And while the image of the inpatient nurse is that which is most visible, today's event provides us the opportunity to recognize those nurses and nursing specialties among us who, while they have received far less attention from the media, are no less deserving of our honor and gratitude. From school nurses who are charged with the safety and well-being of the littlest members of our community, asked to lead and guide the safe opening of our schools in an uncertain environment, to outpatient nurses who are the unsung heroes of our region's provider offices, many of whom found themselves without work at the height of the pandemic or deployed into acute care environments to support hospital-based care. Last week, I had the absolute honor of supporting the nurses of St. Peter's Hospital through the site visit for their 4th magnet redesignation. I could not have been more impressed by the incredible enthusiasm and passion for our patient care possessed by all of our nurses, across disciplines and specialties, and spanning offices throughout the Capital Region. This is not intended to be a plug for St. Peter's Nursing, but instead a reflection on the resilience we as nurses possess, even as many of us, myself included, have just experienced the most difficult years of our nursing career. Too often over the past year, we have heard nurses and healthcare providers referred to as heroes, a recognition of the sacrifices made by the entire care team as they faced an emerging virus with too many unknowns. Instead of heroism, it is my sincerest hope that it is the resilience of our nursing workforce that is most honored as we emerge from this pandemic. As this pandemic continues to take a toll on the emotional and physical well-being of arguably the most critical role within today's healthcare system, we must create the systems and structures to support our nursing colleagues through the lasting impact that will most certainly be felt from this pandemic. As we emerge, we have an opportunity to rethink and reimagine the field of nursing, to honor not only the profession, but also the professionalism of all nursing colleagues, to ensure all nurses in all settings have a voice in the decision-making within an organization. It is incumbent upon myself and other healthcare leaders across the region to create these structures, to engage our nursing colleagues, to understand how we can create this better system and work collaboratively as partners to achieve this future state. Ultimately, it will be through this partnership that we ensure our preparedness for future challenges. While this event recognizes excellence in nursing and aligns itself annually with Nurses Week, I would be remiss if I did not also honor all members of the care team. The incredible care that we as nurses provide to our patients and our community would not be possible without the team of professionals to support. The importance of a truly interprofessional team collaborating for the safety and well-being of one another and for the benefit of our patients has never been more evident than in the past year. Thank you to the providers, the therapists, the aides, and the technicians, the housekeeping staff and dietary staff for everything you do in support of your fellow nurses and your patients. With all that we've been through over the past year, hope is on the horizon. With adult COVID vaccination rates in the Capital Region continuing to climb and a community prevalence that continues to trend downward, we are beginning to feel more normal. This pandemic has undoubtedly changed how we as healthcare professionals manage the health and well-being of our patients and our communities. It has also challenged how many of us on what it means to be a nurse. It is through this challenge that our nursing colleagues have shown the greatest innovation, the greatest passion for the work that they do, the greatest willingness and desire to depart from the way we've always done it. We have among us some of the best and brightest nurses in the nation. It is my sincere hope that we capitalize on this call for change and create a more resilient nursing workforce, to create systems better aligned to manage future pandemics, and to honor the professionalism of our nursing colleagues across the Capital Region. With the incredible stories I'm told throughout this year's nominations, I'm honored to call myself a nurse and serve alongside each and every one of you. Congratulations to all of those recognized in this year's Salute to Nurses.
Okay, let's get to it, shall we? Each year, we ask the community to nominate an exceptional nurse in their life, and this year we have once again received hundreds of submissions. The following are our picks for the 2021 Nurses of the Year. First up is Brianna Bissell, a nurse in the cardiology unit at St. Peter's Hospital. Brianna took on the role of unit supervisor at St. Peter's just as the pandemic was beginning in New York, and has helped to train and guide new nurses as they started their first nursing jobs at perhaps one of the most stressful times possible. During the most recent surge, Brianna started a program called Tide with Love, where staff made handmade blankets for patients who were near the end of life and their families. The person who nominated Brianna described the initiative as bringing much needed light into people's lives, while also being extremely therapeutic for staff. Brianna's dedication to patients is a clear example of the compassion and caring that defines this profession. Next up is Kim Bursees. Kim's nursing career has made an impact near and far. She has helped care for patients locally during her many years with Eddie Daybreak, and she helped care for soldiers overseas while working as a nurse for the Air National Guard in Afghanistan. The person who nominated Kim noted that her endless care and dedication has helped many people during both normal and extraordinary times. Indeed, when the pandemic hit, she decided to return to work for Eddie Daybreak, even though she had already retired to help out during these chaotic times. There, she has been screening students and staff to make sure everyone remains healthy and safe. Our next winner is Christina Citarella, a nurse with Saratoga Hospital. Christina's unit was designated the COVID unit during the pandemic, and according to the person who nominated her, she took charge right away, encouraging and supporting her coworkers and helping them through moments of necessary improvisation, such as when PPE was in short supply early on. Christina was a solution seeker and helped raise the bar for patient care while also remaining cognizant of the needs of her fellow caregivers. As the first inpatient nurse that COVID patients would often see, she was particularly adept at putting patients at ease by offering a greeting that would instill confidence and reassurance in the patient. Christina was there to hold their hands during the scary times and provided emotional support until the very end for those who unfortunately lost their lives to this disease. Another of our winners is Cheryl Clow, a nurse at Albany Medical Center's Children's Hospital. Cheryl has worked at Albany Med for over 30 years and is considered one of the most experienced nurses in the region at caring for children and adults with complex metabolic diseases. In caring for children with rare and sometimes disabling diseases, Cheryl brings her cheery disposition to the bedside and will stop at nothing to make sure patients and their families get the support they need, even if that means dropping off medication at home or giving her own money to make sure the family has enough gas to get home. According to the person who nominated her, she would give the shirt off her back to make sure her patients are taken care of and deserves recognition for her unbelievable heart and work ethic. Our next winner is Laura Pfeiffer. Laura has led the nursing team at Glens Falls Hospital through a 5-year journey to magnet status, a coveted designation that indicates excellence in nursing and patient care and that only 8% of hospitals nationwide have achieved. Laura was also instrumental in developing a comprehensive training plan that redeployed nurses to new practice areas in response to the pandemic. Under her leadership, the hospital won yet another rare distinction, reserved for hospitals with gold standard nurse residency programs. According to the person who nominated her, Laura's expertise in nursing practice issues, work ethic, data management skills, ability to inspire and encourage others, and dedication to the profession are hard to match. Our next winner is Jenna Horton, a nurse at St. Peter's Hospital. A remarkable 23 people nominated Jenna for this year's Nurse of the Year distinction. The patients who nominated her were especially impressed with the time Jenna takes to explain things about their care so that they can understand them, with special attention to detail for her elderly patients. When COVID-19 hit, Jenna did not hesitate to suit up with PPE and treat patients. Her coworkers weighed in as well, describing Jenna as a mentor and brilliant clinician who is also kind and compassionate. Next up is Kathleen Kane, a nurse with the Lexington ARC in Gloversville. Kathleen also received a slew of nominations for her work leading the organization's nursing team over the last year. One coworker estimated Kathleen has been working 12 to 16-hour days, 7 days a week, in order to keep everyone safe throughout the pandemic. Described as caring, compassionate, and tireless, her coworkers have been particularly impressed by her leadership and positivity throughout the stress of the last year. The care that she takes to ensure her colleagues' voices are heard, validated, and communicated has also helped to foster a sense of confidence and pride in all of her nurses. Our next winner is Lindsay Rhodes, a nurse with the Albany Stratton VA Hospital. Lindsay is being recognized for the incredible work she has done to develop an equine therapy program that helps veterans struggling with addiction and mental health disorders. A lifelong horse owner herself, Lindsay and her husband actually own a hobby farm with horses that she tended to while working at the VA and finishing her degree. In 2015, she began working with the VA to develop the equine program, and it got off the ground in 2017 through a partnership with SUNY Cobleskill. In addition to aiding the emotional growth and recovery of veterans participating in the program, her work has also led to the development of a specific equine veteran course for students at the college. Next up is Amanda Strock, a nurse at Samaritan Hospital. Amanda was nominated by a former patient who credited her with helping turn their life around. The patient shared that they had met Amanda on one of the darkest days of their life. They had just entered the ER in withdrawal from a drug addiction, and Amanda greeted them with a smile and compassion, something they didn't always get when trying to seek help elsewhere. Amanda sat beside them and took time to inquire about their past and the origins of their addiction, and even helped educate the patient's mother, who they said was not the most supportive at the time. Before the patient left for rehab, Amanda offered support and reassurance that they were doing the right thing. That was 2 years ago. After finishing rehab, the patient started school and shared that they have been clean now for going on 2 years. Our final winner is Bradley Ruck, an adolescent psych nurse at Ellis Hospital. Brad served in the Army for 4 years as a medic, during which time he was deployed to Iraq, where he saw combat for 9 months. That experience would prepare him well for his career in nursing. After the Army, he went through Russell Sage's accelerated nursing program while also working, helping out with Little League, and caring for 3 children back at home. Sadly, but unsurprisingly, Brad's workload caring for adolescent psych patients throughout the pandemic has only grown, but his level of care has remained the same. He even turned down a promotion because it would have taken him away from working directly with his patients. Congratulations to all our winners. Because we received so many phenomenal submissions, we also like to pick a handful of finalists as well. Because of time constraints, I will spare you their full biographies, but please join me in congratulating the following finalists. Marlene Austin, a longtime nurse at Albany Medical Center. Jean Bratt, a nurse at Samaritan Hospital. Nathaniel Compton, a nurse at Sunnyview Rehab Hospital. Maria Kranker, a COVID nurse at Samaritan Hospital. Scott Ferris, an emergency room nurse at St. Mary's Hospital. Audrey Harris, a nurse at Glens Falls Hospital. Ruth Jameson, also a nurse at Glens Falls Hospital. Christine Janak, a nurse with Saratoga Hospital's Oncology Hematology team. Stephanie Joslin, a nurse at Saratoga Hospital. Elena LeBaron, a COVID nurse at Saratoga Hospital. Divya Mohan, a nurse with the Lexington ARC. Debbie O'Reilly, a nurse at Corinth Middle High School. Sally Parker, a nurse at the Albany School of Humanities. Terry Stratton, a nursing supervisor at the Eddy Visiting Nurse and Rehab Association. And Jane Babinsdale, a nurse with Saratoga Hospital Medical Group's cardiology team. Congratulations again to all of our winners. We are so thankful that you are here and continuing to serve our communities with compassion and care. Thank you as well to our sponsors for making this event happen, and of course to all of you for taking time out of your day to honor these incredible nurses. Be well.
I'm Jim Reed, President and CEO of St. Peter's Health Partners. It is my great privilege to honor this year's Salute to Nurses recipients. Over the past year, you have shown unrelenting bravery as you confronted COVID-19. You have overcome your own fears to hold the hands of the sick so that they might conquer their fears in order to heal. We know this hasn't been easy. You have worked long, stressful, and physically demanding shifts. Many of you have even learned new skills to redeploy to new clinical areas, yet you never wavered. Your exceptional care and gentle human touch have brought relief to those in need, and with the arrival of vaccines, hope of better days ahead, hope that this pandemic will soon be behind us. To the nurses representing St. Peter's Health Partners, we are proud of you and deeply thankful for your talents, your compassion, and your dedication. And to all Capital Region nurses, we would like to express our sincere thanks for all you do every day. We salute each of you who have given so much to your profession, your patients, and to our community. Thank you and congratulations.
I think this past year has definitely been the most difficult. But the relationships with our coworkers and us becoming a tight-knit family is, I think, the best thing that has come over this past year.
Everybody was scared when this started, and then they put their stuff on and they came every day, even though we had no idea what was going on. We didn't know if we were going to get sick and die. And it was scary, and people could have quit, and they didn't. They put their stuff on and they came every single day.
During that time, my team, my coworkers, the people that I work with, we really bonded. It really formed a stronger bond. I feel like we already had a strong bond, but it just got even stronger. Just being able to lean on each other through that time.
So the past year obviously has been tough and difficult and different for everyone. For me particularly, I work in an outpatient setting in the world of genetics. So individuals who meet me and then end up getting a diagnosis have a lifelong relationship with me. So for me, in a pandemic, what that means is we have actually had telehealth visits. So that is a wonderful thing that modern technology has been able to accomplish for patients.
We've really needed to change every single day what we're doing, what we think we know about medicine, what we think we know about disease, how to treat disease has changed, but also how we work together has changed. And it's really made the profession of nursing better as a whole.
It's been frustrating. It's been scary at times. I found that I actually had retired, and the place that I retired from called me back to do all their COVID screening and everything because of my military background, because we went into a lot of areas where you had to use precaution because of all the diseases and stuff. So I got a chance to work with more and more people as a team to make it so that students could return back to school in a safe environment and keep it to the point where hopefully we wouldn't have to close our school down. And we've been very fortunate.
I can tell you that I hope to never have to work through another pandemic, in my career, because this has been unbelievable. But I think, there's obviously been a lot of emotional downs for all of us. We've seen some very tough things, but I think in the other respect, it has brought out the greatest in everyone. People have pulled together. My team has been amazing.
This past year has really shown us that nurses will always prevail, and we can pivot to meet the needs of our society and meet the needs of those that we serve.
My first memory was when I was working as an RN in a fertility clinic, and I was working with one specific patient for years, and she had spent every dime she had and cried every tear that she had trying to become a mom, and her husband never ever lost hope throughout the entire experience. He was so positive, and he would take photos of everything they did. If it was getting her blood work drawn or having an ultrasound or just speaking to me, he would take photos because he wanted to really document their journey to becoming parents. So when she finally got to be pregnant and I got to be the person to call her and tell her she was finally going to be a mom, I wanted to have somebody take a photo for me so that I could send it to her husband and add one more final photo to that journey that they were putting together. And the person who was taking the photo accidentally took a video instead. And I have this beautiful video of me telling her she's pregnant and all of the staff that I worked with, that she had worked with for years, crying and yelling and being so excited for her. You could actually hear her yelling through the phone a little bit. And she doesn't know this because I'm actually still very close with her. But sometimes when I have a really terrible day at work, I watch that video so that I can remember why I'm doing this, what kind of impact I'm really making for people. I had this patient that I took care of on the cardiac unit for about 2 years. She would always be in and out of the hospital. She was diagnosed with ovarian cancer. So I got to know her really well and her husband. and their whole family, their children, their grandchildren would come and visit. And I always would think about her. And then I had seen like about a year ago that she had passed. So I had thought of them, and I had written this note to them in February, early February, and made this blanket that made me think of the patient that I took care of that had passed. Just the colors, she just had this red hair, and she would be in this nightgown, and she was just this beautiful, beautiful person. And then about 2 weeks ago, her husband ended up on our floor again, because I could never figure out what their address is, because I wanted to drop it off, because I've been dropping off the blankets and a condolence note on the doorstep of houses of patients' families, but I didn't exactly know what his address was, so I was never able to give that. So then just to see him just after all this time, like 2 weeks ago, it was just, I was able to present him with the blanket, and we were able to talk about his wife, and I was able to see the family again, and just to have it come full circle, to be able to give it to someone who inspired the project and who I've thought of, was just a really, really, really special moment.
One thing that happened that I will never forget is the community put on a parade for the nurses and all the staff here at Glens Falls Hospital. And we knew that they were coming, and we thought a few cars were going to go by and they were going to wave to us. And it lasted almost an hour. Car after car of community members, families, little kids with signs waving, thanking at all of us, the fire trucks, the ambulances, the police cars. We all were crying, because sometimes nursing is like we're the unsung heroes, and we felt finally somebody realized what we did was important, and it was difficult, and that we were brave, and that especially the nurses that were working so hard at the bedside were heroes. So I always will remember that parade, and how I don't even know if the community knows how much that meant to all of us, for them to thank us and to acknowledge us for being, here during such a difficult time.
I'd have to say that my very first day on the job is probably my best memory, because everything kind of came together and it all made sense. Why I went to nursing school, why I want to help people and fix things. So yeah, I say that's probably my favorite memory.
Why did I become a nurse? So I've always loved helping people. And when I was in school, I was a science major, and just the thought of being able to help people, not only physically, but emotionally and spiritually, and really be able to spend time with the patients, and to have that connection and get to know them, and be able to help them in all those different ways, is why I got into nursing.
That's initially why I became a nurse, because life is hard enough for people to go through day by day, and if I could make a difference and help make it better for someone, then I wanted to do that.
I have always wanted to do something impactful and always wanted to leave my mark in the world somewhere.
I wish my story of why I became a nurse was glamorous and fun, but it really isn't. I never wanted to be a nurse. I hated the sight of blood. I was terrified of needles. And I came home one day when I was 18, and I told my mom I wanted to go to nursing school. I was just talking to her about this the other day, and she said, I can remember looking at you going, have you lost your mind?
Looking back, I realized that I wanted to become a nurse way back in high school.
I always liked helping people, and for some reason I always feel that I need to fix things, and I recognize that nursing would allow me to do that professionally. So that's why I got into nursing, and it certainly has allowed me to help people and fix a lot of things.
I decided to become a nurse and enter the field. Really, it was an easy transition from being a medic in the Army at the time, something that transitioned into a civilian job that I felt like I would be able to fit right into. And so for me, as is often the case, I think with people who work in this type of a field, I just find satisfaction in trying to help people in their times of need. And really, that's the bottom line.
I love it. I mean, I never thought I'd be where I am today. Let's put it that way. It's been an exciting ride through my life as a nurse.
it really fit well for me. I am able to make that difference for people that I really wanted to, whether it's on a large scale or just on a small scale with individual patients.
I am absolutely in love with my career, and I don't think I'll ever leave.
Inspiring words and moving emotions from professionals making a difference in the Capital Region. Let me add my congratulations to those that have come before for all of this year's honorees, and add the wish for a far less nerve-wracking chapter in their careers in the months and hopefully years ahead. To those watching, we thank you for allowing us to tell your stories, and to our business partners and subscribers for supporting the power of local journalism. Thanks again, and please be well and stay safe.